Hello guys, and welcome to this video to talk about cysts. So how to diagnose odontogenic cysts, differentiating from other periapical lesions, and then how to treat those cysts with surgical removal. Okay, so those are very important points basically about periapical lesions. So the first key point that is very important here is to detect the common differences between cysts and granuloma and also other lesions such as odontogenic tumors. So now you guys have on your screen two different images, image A and image B, right? Feel free to pause the video and try by yourselves to make a differential diagnosis list for each of them, or at least to try your best to name those lesions, okay? So, and for those who were able to do it, congrats, because we have first a granuloma and then a radicular cyst, okay? So those are the lesions. And why? Basically, the granuloma is a well-defined periapical radiolucent lesion, but not so symmetric, not with corticated borders, which would be characteristics of cysts. Usually not so radiolucent, but that's arguable between the articles. And also, usually cysts are found in a little bit a larger size, more symmetric in relation to the apex. So those are very important aspects. Then, if you have an acute infection with ill-defined bone resorption, that would be an abscess. The abscess could have or could not have a radiolucent image or radiographic manifestation, but that's topic for another video, just for you guys to differentiate. However, we still need to make sure that this is not, an odontogenic tumor, although it looks like a cyst, but we need to see in 3D, especially to plan the surgical removal, okay? So we need to see the CBCT of this case as well. So let's see an entire case with all type of images that you guys may find in your career, okay, to diagnose this type of lesion. So let's start with this panoramic radiograph of this case. Again, feel free to pause the video to try to detect where we have the lesion, okay? And for those who were able to do it, again, congrats, because we have a huge radiolucent lesion, well limited, homogeneous as well, and that's actually a cyst, okay? So the lesion is actually related to the upper right maxilla. Of course, if we want more details, then we would take a periapical radiograph, as you guys probably saw in the last lecture about OPGs. If you guys didn't see this lecture, then this will be the first link on the description below, okay? So let's see the periapical radiograph of this case, and now we are seeing that the lesion is related to the 1-1 and the 1-2. The 1-2 is more centralized to the lesion, so we may suspect more about this tooth, but then this is a cyst, so it's not only a matter of treating a root canal again, we need to surgically remove the cyst, otherwise this cyst could still develop, right? That's how we face cysts. So here the treatment would be a surgical removal. And there are different techniques to do that, but in most of the cases you would be able to do the surgical removal along with the epithelium surrounding the lesion, and that's called enucleation. So we are going to talk about that as well. But again, we are seeing the periapical radiograph, so now we can see in better details the lesion. And we are seeing also that there is a radiopaque area inside the lesion, which is suggestive of endodontic material, right? So the obturation material, maybe, it's a little bit, the obturation was overextended, and then we have a little bit of endodontic material inside the lesion, okay? And that's why the lesion on the periapical radiograph is not so homogeneous. So we can also expect a little bit more infected, aspect because of that. But we still need to plan the surgery, right? So what is the next step here? And the next step, of course, is to take a CBCT. We need 3D information here. So now I'm showing to you guys the CBCT, and now let's understand what's going on. The CBCT is showing us clearly the extension of this lesion, okay? So take a look at this. The lesion is extending from buccal to palatal, from the buccal plate to the palatal plate entirely. So basically the lesion is taking over at that point, okay? So we have on the top left the cross-sectional images, okay? So those are the cross-sectional images, and then we have on the top right the axial slice, on the bottom right the 3D reconstructed model, sometimes it's useful, and then in the bottom left we have the coronal panoramic slice, to help us guiding where we are on the other planes as well. Now you guys are able to see the second key point, which is that CBCT, as I said, is usually recommended for surgical planning, okay? So now we can see the entire extension, even the mesial distal extension of the cyst, right? So distally, the cyst is in continuation with the medial wall of the maxillary sinus, right? And this is happening actually throughout the entire alveolar ridge from buccal to palatal. It's in contact with the sinus, right? So we can see that it's extending almost to the midline mesially, so to the sagittal midline, you know, and then it's extending from buccal to palatal plates, okay? Now let's understand a little bit more about the cross-sectional images. Those in red, inside the red square, are the cross-sectional images, and the location of each of these slices is basically those blue straight lines that we can see on the axial slice. So let's talk about this a little bit further. We can see now the buccal lingual or buccal palatal extension on each of these slices, and the location of the slice in the middle is basically this blue arrow that you guys are seeing now on the screen. So that's why we can see throughout the extension of the cyst the buccal lingual extension of this lesion. Okay, so that's how we would proceed to diagnose this lesion with CBCT. So let's talk about the treatment now. The third key point here, which is that the odontogenic cysts are usually in most of the cases treated by enucleation, as I said, which is the surgical removal of the entire lesion along with the surrounding epithelial tissue. All right, so let's see an example of this. This is the pictures of the same case, so the cyst associated to the 1-1 and 1-2, the central and the lateral incisors of the upper right maxilla, and this is what we are seeing after opening a flap, okay? So you guys are seeing the flap opened only with one releasing incision, so the Neumann flap is on the screen, and then we have, you know, we need to open a little bit more the buccal plate because, you know, we can almost see the cyst, but you need to get access to the cyst to be able to enucleate this cyst, right? So now we need to use a spherical burr a little bit, and then we are going to be able to reach the area of the cyst. You know, the cyst is basically in continuation with the buccal plate. And then all we need to do is, of course, to use a curette, you know, so you would detach the lesion from the bone surrounding, okay, so, and then you would be able to eventually remove the entire lesion along with the surrounding epithelium, as you guys are seeing on this picture on the top right of your screen now. Now we have, you know, the site of the lesion, and we are going to eventually see a blood clot forming there. And that's important because when we have blood clot, we have migration of bone and connective cells, and then of course we are not going to have an infection of this bone, right? So we are not going to have osteonecrosis, for example. And then we need to close this, so we need to close the flap, and before, of course, we want to make the initial sutures only to place them in position before closing them, actually, to be able to place the collagen membrane, okay? So we are going to use a collagen membrane to close the site of the lesion, so the hole that we had the lesion. So we are going to suture. If we have the papillas involved, just like in this case, then you are going to suture all the papillas. If needed, you can release the periosteum as well, and then you will be able to finalize this case, you know, removing the sutures after 7 days. You know, those were nylon sutures, for example, but if you were using resorbable sutures, then you would have the option to remove or not. So those were the key points of today to help your studies, and see you guys on the next videos.